If we can't get a good latch, then you don't make milk and everything kind of dominoes from that. So when you go to latch baby, first thing you want to do is make yourself very comfortable because you're going to be there sitting there for a while. Bring baby to you, make yourself comfortable. Babies have had their fingers to suck on, but they have never had to open their mouth very wide. So that's teaching them. They've also been wadded up with their chins down. If you put your chin down, you can't open your mouth very wide. So the most important thing is getting that baby to stretch out a little bit, reach a little bit, touch your nipple to the top lip and make them reach, because that brings their jaw down, brings their tongue down, and makes everything more comfortable because they reach back to those milk ducts, which help you make milk. I want the top lip up, the bottom lip down, and I want to see the baby pull from clear back by that ear. And when I talk to you, then I want you to say, yes, I feel a tug. If there's a pinching, then baby's not rounding that tongue underneath. And then maybe as you pull your nipple back out, it will look either flat, pinched, or it will look like a lipstick. And that's not how we want your nipple to look. I want your nipple to look the same going in and the same coming out. And that will also drive our comfort level. And with that top lip up and bottom lip out, that has fluid flow because it's wet, so it makes things slide better. When they reach back further, that is the stimulation to help empty those milk ducts. The more you nurse, the more milk you make. And then those hormones that are on board are getting stimulated to help you make that milk. So babies need to eat about every 2 to 3 hours or 8 to 12 times in 24 hours because that helps your milk supply. If we let them go longer and we don't use those hormones while they're there, then we have problems with milk supply down the road. That baby's tummy only holds about 1/4 of a teaspoon from the very beginning. And as your milk comes in, that baby's tummy grows. So within the first couple days, they're getting that good colostrum, small amount. You may only hear 1 or 2 swallows because they are having to learn to suck, swallow, breathe, which they've never had to do before. They never had to put that swallow stuff in. Sometimes they get very sleepy when you do that, but make sure you're taking their clothes off to help them keep awake. So we want to get all those good feedings in, and a feeding to me is anywhere from 10 to 15 to 20 minutes, probably not much longer on a side than that, and that you're able to either see them swallow or hear them swallow, and then they're content after feeding. So at first, that's how you tell baby's content. As time goes on, it takes about 3 to 4 days, depending on what baby it is for you, for your milk to start coming in. And then to me, that makes it a little more easier for moms to know, because when your milk comes in and you can see milk and you hear all that gulping, then you kind of relax and say, yeah, now I'm not so nervous because I know I'm making milk. But the other thing that you can watch to know that your baby is getting enough milk is those wet and dirty diapers. If they're having wet and dirty diapers, they are getting enough at breast. So as your milk comes in, then we expect them to have 5 to 6 dirty and 4 to 6 wet diapers in 24 hours. That also tells you that baby's getting enough. Just, whatever you're giving them, it's coming through. So if babies are content between feedings then and are having wet and dirty diapers, we're good. Those hormones, those prolactin and all those good hormones that help us produce milk are present. So the more we stimulate and the more the baby nurses, the more milk you make. Well, that milk isn't normally there on a normal basis. So as that baby sucks and milk starts to come, they get pretty full and pretty tight. It makes it a little uncomfortable for mom. You finally taught that baby how to latch because you're nice and soft, and now they're full and now they're taut, and sometimes they're so swollen because that milk has never been there before, and so then your body sends all this extra fluid to protect you from that milk, which sounds kind of strange, but that's what's happening. So they get kind of taut. the nipple kind of disappears and you go to put that baby to breast, and it's like he shakes his head and can't get a good hold on that breast like he did before. So what we need to do is heat always before. That helps move milk down into those ducts and soften things up a little bit. A little massage, just, you can use your thumbs, you can use the heels of your hand, just to soften things, keep circulation going and get things moving. If that doesn't work, and you can also do some nipple stimulation. If that doesn't work, you can express a little bit of milk, or if you have a breast pump for home, you can hand express. You can use just a hand pump, or if you have a nice double electric pump, I usually tell moms to go home, set that up so you can not be stressed and just use that, pump a minute or two to soften things up so baby can get on. And baby may only take one breast then, because you're making all of this milk and their tummy has gone from that 1/4 of a teaspoon, tiny, into holding about 1 ounce to 2 ounces by the end of 2 weeks. They may only nurse one side because they get kind of full and nurse the other side the next time. That's fine. Eventually by the end of 2 weeks, that's kind of our end point. And they should be nurse one side first, finish, and then if they're still hungry, finish, start on that other side, and then you would start on that side the next time. Pumping for 10 minutes and stopping for 10 minutes, and you do 3 rounds of that. What that's doing to your body is telling your body that baby ate and rested and ate and rested, and that's what helps us produce milk. So that's sometimes a nice way to kind of bump your supply up and get a little bit of milk ahead. There are many pumps out there. There's getting to be more and more and more, and I'm not even up to date on all the pumps that are out there. Medela used to be kind of the standby, and a lot of companies have jumped on board. A double electric pump will give you better stimulation and better milk supply. If you're just using a hand pump here and there, that's fine. What I have found out from some of my nursing moms, some of the hands-free pumps that are out there right now are very handy and help free up some time for you, because you can program them and hook them up if you have a hands-free bra, and you can feed your kids and you can vacuum and you can do dishes and you can do laundry. But if you're solely using that for supply and find that your supply is dropping, you may want to use your Medela or your double pump a couple times a day to help keep that stimulation up. The hands-free just don't have as much suction or good stimulation sometimes to help keep your milk supply. So it's great to use them. Just don't get rid of your standby pump, and use that a little bit to help keep your milk supply up. We all understand how hard it is to breastfeed babies. Whoever says it's easy, it is not. After 2 weeks, I hope that will change your mind and you'll say, yes, I'm glad I stuck it out. Please feel free to call. I can do one-to-one consultations anytime. You just have to call. So don't sit at home and worry about it. Let's make it a success story for you.